My name is Michael Liu. I'm the Director of the Maternal and Child Health Bureau at the Health Resources and Services Administration, or HRSA, U.S. Department of Health and Human Services. I was asked to talk about improving the health of America's mother and children from a life course perspective. But before I start, let me just take a moment to thank the staff at the National Governors Association for all they've done in establishing this learning network. NGA has been a strong partner in our Collaborative Improvement and Innovation Network, or COIN, and I'm thankful for their leadership and partnership. I also want to take a moment to congratulate you all on being selected to this learning network. I especially want to thank Governor Bentley and State Health Officer Dr. Don Williamson for their leadership and support, and give a shout out to your Title V program, your Healthy Start programs and home visiting programs, the COIN team, and really all of you who are here today, and many other folks out there across the state for all your hard work and dedication in bringing down Alabama's infant mortality rate to a historic low. You remind me of what Dr. Martin Luther King Jr. once said. He said that human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle, the tireless exertion and passionate concern of dedicated individuals like yourself. So, again, I'm sorry I cannot be there with you in person, but I just want to tell you on behalf of HRSA and the Maternal and Child Health Bureau how much I appreciate and admire all that you do for mothers, children, and families in Alabama and for our nation. I was asked to talk about the life course perspective. Simply stated, the life course perspective is a way of looking at life not as disconnected stages, but as an integrated continuum. It's a conceptual framework. Some people might even call it a paradigm shift that recognizes that each stage of life is influenced by all the life stages that preceded it, and it in turn influences all the life stages that follow. I think this is especially important for us to recognize in maternal and child health, where one life stage is often disconnected from the next. For example, in perinatal health, we focus so much on those 9 months of pregnancy that we often forget that there are a great deal of life course influences on perinatal outcomes and a great deal of perinatal influences on subsequent life course outcomes. For example, in explaining this black-white gap in birth outcomes, for decades we searched for those risk factors during those 9 months of pregnancy and then looking at the woman's cumulative life course experiences exposures. I think the danger of looking solely at pregnancy risk factors is that not only do they not explain the disparities very well, they could actually misguide public health programs and policies. For nearly 2 decades now, we thought that if we could just get women access to good prenatal care, then we could really do something about closing this gap. Today, many of us are beginning to recognize that to expect prenatal care in less than 9 months to address all the cumulative disadvantages and iniquities that's accumulated over the life course of the woman and family is probably expecting too much prenatal care. And if we really want to do something about improving birth outcomes and reducing disparities, we got to start to take care of women not only during those 9 months of pregnancy, but before pregnancy, between pregnancies, and beyond pregnancy, and indeed across their entire life course. The life course perspective consists of 2 major components, early programming component and a cumulative pathway component. And let me briefly describe each one of these 2 components and give you some examples of them. The early programming component posits that experiences early in life, including those when you were just a baby inside your mother's womb, these early life experiences can influence your health and function in life. And this is the basis for the Barker hypothesis that's being receiving a great deal of attention lately. And what the Barker hypothesis does, what Barker and his colleagues through a remarkable series of studies found is that there's an association between being born low birth weight and increased risk for heart disease, hypertension, and diabetes later on in life. Now, if I were to ask you, tell me some risk factors for heart disease, what would you count? Well, hypertension, smoking, high cholesterol, obesity, the low birth weight. What does being born low birth weight have anything to do with your risk for hypertension and heart disease later on in life? Well, what David Barker and his colleagues hypothesized that there are these sensitive or critical periods during development during which the function of an organ or systems are being programmed, and if things don't go right, if something goes wrong with that programming, then that organ or system may never function optimally over the entire life course. A simple minor example is that if you were to have undernutrition during the second trimester, when the pancreas or the kidneys are rapidly growing, you end up with a smaller pancreas with fewer beta cells or smaller kidneys with fewer nephrons, and that may lead to increased susceptibility for diabetes or kidney diseases later on in the life course. Now, as you can imagine, the Barker hypothesis was met with a great deal of skepticism and even some ridicule early on. But over the past couple decades, there's been a growth of scientific evidence that's beginning to support this whole notion of early programming. And let me give you an example of that from my own area of research around prenatal stress and fetal programming. Now, let's say your mom was stressed out when she was pregnant with you. Well, what happened? Well, we know that her body puts out these stress hormones. In a couple different ways, these stress hormones can cross the placenta. So in a sense, you're bathing the baby in all of these stress hormones. You're priming the fetal brain with all of these stress hormones. What do you think that does to the baby? Well, we now know from animal research that there are two areas of fetal brain that are particularly susceptible to the neurotoxic effects of the stress hormone cortisol, and that's the hippocampus and the amygdala. Now, the hippocampus is the site for learning and memory formation, and rats exposed to a great deal of prenatal stress actually have a real tough time forming new memories and learning new tasks. The amygdala is the site that mediates anxiety and fear, and yet rats exposed to a great deal of prenatal stress shows a lot of anxiety and fear during aversive situations. But more importantly, the hippocampus and the amygdala regulate the hypothalamic pituitary adrenal axis, or the HPA axis, which basically mediates your fight or flight response. Now, I know this slide gets a little complicated, but bear with me for a minute. Okay? I want you to think of the hippocampus as a brake pedal. It brakes the action of the HPA axis. And I want you to think of the amygdala as an accelerator pedal. It accentuates the action of the HPA axis. So when mom is stressed out during pregnancy, her body puts out a lot of glucocorticoids, cortisol in humans, corticosterone in animals, which during critical periods of development actually start to down-regulate glucocorticoid receptors inside the hippocampus, so you're making that negative feedback loop less sensitive. At the same time, it's upregulating glucocorticoid receptors in the amygdala, so you're making that positive feedback loop more sensitive. So what this means is that you're making the brake pedal less sensitive, and you're making the accelerator pedal more sensitive. What are you going to get? You're going to get a baby with an HPA axis that's more overactive, a more hyperactive fight or flight response. And in a way, if you think about this actually makes a lot of sense. What mom is doing during pregnancy, if mom is trying to get the baby ready for the outside world, And if the outside world is stressful and hostile, what's mom going to do? She's going to try to get the baby ready by revving up that whole fight or flight response, by revving up that whole HPA axis, which in the short run could actually confer some survival advantage, but in the long run could have some very serious health and developmental consequences. In fact, there are now at least 14 studies that link maternal anxiety and stress during pregnancy to increased risk for ADHD in childhood, suggesting that there may be something with the way these stress hormones influence the hardwiring of that fetal brain that may have some very serious and perhaps lifelong consequences on child health and development. And I think what's most fascinating about this whole business of fetal programming is this phenomenon called epigenetics, which is basically volume control for genes. You can turn up or down, you can switch it on or off your gene expression based on your environmental exposures, especially those exposures during critical periods of development. And you can do that simply in many different ways, but one very simple way and very common way is to put a chemical tag. In this case, we're talking about a methyl group, 1 carbon, 3 hydrogen atom. You put that tag directly in front of that gene, and that blocks that gene from being expressed. Alternatively, if I were to take away that tag, then that gene is allowed to freely express itself. So generally speaking, methylation turns off, turns down gene expression, whereas demethylation turns up, turns on gene expression. So what we think may be going on with prenatal stress is that you can actually control the amount of glucocorticoid receptors that gets expressed inside the fetal brain simply by methylating or demethylating the DNA. I think this is fascinating because you can now have two individuals with the same identical genetic codes, and they can end up with very, very different levels of stress reactivity based on what? Whether their DNAs are methylated or demethylated, which is based on what? Whether their moms were stressed out or not during pregnancy. Again, attesting to the important and potentially lifelong impact of maternal stress on child health and development. Now, just to drive home the importance of epigenetics, let me give you another example. What do you see on this slide? Well, you see some blonde and chubby mice, and you see some brown and slim mice. Would you believe these mice are actually genetically identical? And see, all of these mice carry a gene called agouti gene, which basically turn their fur coat blonde. The same gene also causes them to overeat, which then confer a high risk for obesity, diabetes, and heart disease later on in the life course. Well, in this research, what was fascinating was that the researchers were able to turn some of these mice from blonde and chubby to brown and slim simply by feeding their mothers a diet rich in folic acid during pregnancy. Now, folic acid, what does folic acid have anything to do with? Well, it turns out that folic acid is a very rich methadone. And so moms, it's got a lot of these methyl groups. So moms who ate a diet rich in folic acid basically methylated, blocked, silenced the obesity gene before her baby was ever born. Imagine that, someday being able to tell our patients that we know how to turn on those genes that's going to confer upon your baby good health and longevity, and turn off those genes that's going to cause diabetes, heart disease, and cancers later on in the life. Well, we're certainly nowhere close to being able to say that now, and I do want to caution you against extrapolating too much from one animal studies, because not all humans are rats, but this is certainly one of the earliest and best examples of how early nutrition can impact on your DNA methylation, and that such epigenetic changes early on in life could actually have lifelong and perhaps even intergenerational impact on health and function. Now, the second component of the life force perspective is the cumulative pathway. And what the cumulative pathway says is that chronic stress, I'm talking both in terms of biological as well as physical and psychological stress, that chronic stress can cause wear and tear to your body's adaptive systems, which over time can lead to a decline in your health and function. Well, how does that work? Well, let me give you another example from the stress literature. This time your mom didn't have to be stressed out when she was pregnant with you, but rather that chronic stress and strain, that daily wear and tear that women, particularly women of color, go through, that causes a more rapid decline in their health and function. Okay? And how does that work? Well, what happens to your body when you're under stress? What happens when you see a saber-tooth tiger? Well, you run, right? And what helps you run faster is your body activate that whole fight or flight response, the HPA axis and the sympatho-adrenal medullary system, and you're putting out all of these hormones to help you run away from the tiger. Now, what happens after you got away? You relax, right? Your blood pressure comes down, your pulse comes down, and you relax. And that's the amazing thing about the human body, that it's self-regulating. It knows to shut itself off once the stressor has been removed. And that's what we call allostasis, which means to maintain stability through change. Maintain stability through change. Now, allostasis works very much by a negative feedback mechanism that's common to many biological systems. It works very much like a thermostat. So let's say the temperature in the room that you're in right now falls below a preset point. What happens? Well, the thermostat kicks in the heat, right? But as soon as that preset point is reached, what happens? The heat turns off the thermostat to prevent your room from being overheated. So that's allostasis. It's maintaining stability through change. But it turns out that the same thing actually goes on inside your body. So when you're under stress, your body kicks in the HPA axis to produce cortisol. Cortisol, in turn, feeds back negatively onto your brain to shut off the HPA axis to keep your stress response in check. That's allostasis, maintaining stability through change. But allostasis works very well for stress you can either run off or fight off or run away from. But what happens if there's nowhere to run? What happens if you can't get away? Well, in the face of chronic and repeated stress, your body loses that ability for self-regulation, so now you can turn it on, but you can't shut it off. Biologically speaking, for those of you who are more biologically oriented, what may be happening is you get that chronically elevated level of cortisol, which starts to down-regulate glucocorticoid receptors inside your brain, so you start to lose that negative feedback, and we find in animals and humans who are subjected to chronic and repeated stress, they lose that ability for self-regulation, so now they can turn it on, but they can shut it off, and they start walking around with higher circulating levels of stress hormones. And if you were to subject them to some natural experimental stressors, they would put out a lot more stress hormones than people naturally would, and that's when you start to go from being stressed to being stressed out. Okay? And that's actually a big, big difference here. It's a difference between protection and damage. Because under acute stress, your body activates a sympathetic response to increase your cardiac output, the amount of blood that's pumped out by your heart per minute to help you run away from the tiger. But under chronic stress, when you're stressed out, you can't shut off that sympathetic response, and that chronic uncontrolled uncontrolled sympathetic activation over time can lead to hypertension and cardiovascular disease. Under acute stress, your body kicks in the HPA axis to produce cortisol. And cortisol is a glucocorticoid, and one of the main functions of glucocorticoids is It actually converts your body stored energy into glucose, which becomes readily available fuel to help you run away from the tiger. And it does that partly by impeding insulin action. But when you're stressed out, you can't shut off that HPA axis, and all that excess glucocorticoids over time is going to lead to glucose intolerance and insulin resistance. Under acute stress, your body's immune system actually works better. But under chronic stress, as most of you know, you become a lot more susceptible to infection and inflammation. And the way to think about this is to think of your HPA axis as a set of brakes on your immune system. So when you're chronically stressed out, that's like driving with your foot on the brake. Now, what happens when you drive like that? We all hate to drive behind people who drive like that, right? The car just doesn't run very well, as in the case of depressed immune function and increased risk for infection. And we have data that show that women who are under chronic stress are a lot more susceptible to infections like bacterial vaginosis, which could then increase their risk for preterm birth. But if you keep on driving with your foot on the brake, what's going to happen over time? You're going to wear out those brakes, right? And now you have a much bigger problem. You can't stop the car, as in the case of runaway inflammation. And think about all the chronic diseases in our society today that are characterized by excess runaway inflammation. Think some of hypertension, heart disease, Alzheimer's, and think about all the diseases that are characterized by a great deal of health disparities. All the immune diseases, lupus, nephritis, and do you think that chronic stress may actually play a role in the pathogenesis of chronic diseases and in the origins of health disparities in our society today? And lastly, under acute stress, you actually get growth of neurons inside the learning centers inside your brain, the hippocampus and the prefrontal cortex. It's almost as if it's designed to help you learn from your mistakes. And that's why I bet most of you still remember vividly exactly what you were doing when you heard about 9/11. And I think some of you could probably still remember vividly exactly what you were doing when you heard that JFK was shot or Dr. King was shot. Under acute stress, you get growth of neurons inside the learning centers inside your brain. But under chronic stress, the exact opposite happens. So rather than growth, you actually get atrophy and death of these neurons inside these learning centers. And that's why women who are under chronic stress begin to report that they're becoming more forgetful, that they're losing their memory. And Bruce McEwen at Rochester University provides perhaps the best illustration of these concepts with allostasis and allostatic in this cartoon here. If you look down on this bottom image here, that's a picture of allostasis. Right? Two kids balancing on a seesaw, maintaining stability through change. But what if I were to replace these two 5-kilogram kids with these two 500-kilogram sumo wrestlers? You put so much stress and strain on that seesaw that sooner or later that seesaw is going to break. And what if a pregnant woman were to enter pregnancy carrying these two 500-kilogram sumo wrestlers on her back? It's not going to have a very good pregnancy issue. I have served on the Institute of Medicine Committee on preterm birth, which put forth a major report back in 2007. And during committee meetings, we had a lot of discussion about the need to rethink the causes and prevention of preterm birth in this country. And this is certainly a very important issue because preterm birth is a leading cause of infant mortality in this country. The 12% of babies that are born preterm in this country accounts more than 2/3 of all infant deaths in this country. preterm birth is also the leading cause of racial and ethnic disparities in infant mortality. You all know that an African American baby born today is about 1.5 times as likely to be born preterm, and 2.5 times as likely to be born very preterm, and that 2.5-fold difference in very preterm birth accounts for more than 2/3 of all excess black infant deaths in this country. So if we could really do something about preventing preterm birth, then we can really do something about reducing infant mortality and closing this disgraceful gap in infant mortality in our nation. Well, during committee meetings, we had a lot of discussion about the need to rethink the causes and prevention of preterm birth in this country, and that's because we used to think that preterm birth was the consequences of some precipitating event, like a stressful life event or infection that occurred around the time of onset of labor. But we now think that the origins of preterm birth may occur much earlier than that, and that your vulnerability to preterm delivery may be traced to not only exposure to stress and infection during pregnancy, but more importantly to your host response to stress and infection, and that's the stress reactivity and the inflammatory dysregulation that's been patterned over the life course by these early programming and allostatic load, cumulative allostatic load mechanisms that I've been talking about. And so if we really want to prevent preterm birth in this country, what do you have to do? Again, the message is a simple one. We've got to start taking care of women, not only during pregnancy, but well before they get pregnant. And I think that very, very important objective of preconception care has to be to restore allostasis and optimize women's health before they get pregnant. Just in case you think I'm just talking about the babies, I'm not. Because that same stress reactivity and inflammatory dysregulation, that same allostatic load that wreaks havoc during pregnancy will continue to wreak havoc in mom's blood vessels and vital organs to cause chronic diseases in the next 15, 20 years. So we're beginning to get studies like this one that I'm showing you on the slide here, where women who had a preterm birth were significantly more likely to get hospitalized or die from a heart attack in the next 15, 20 years compared to women who didn't have a preterm birth. And studies like these are beginning to reframe the whole issue of preterm birth from simply a children's health issue to a women's health issue. That preterm birth may be a sign of things to come, and that it may herald the development of chronic diseases later on in the life course. So let me just conclude with one of my favorite Chinese proverbs. If you want 1 year of prosperity, grow grain. If you want 10 years of prosperity, grow trees. But if you want 100 years of prosperity, grow people. To which I would just add, if you want to grow healthy people, you start by improving maternal and child health. I know that's not a Chinese proverb, but it's what we have to do if we want the next 100 years of prosperity in America. Congratulations again on being selected to NGA's Learning Network. Have a great summit, and sorry I cannot be there with you in person. I'm there with you in spirit, and thank you for all that you do to improve maternal and child health in our nation. Thank you.